Hi, my name is Darlene and I'm from Fayetteville, North Carolina. And today is my 6-week post-op appointment with Dr. Hay. I'm feeling great, which I know 6 weeks I'm probably going to feel a lot better in 6 months, but at 6 weeks I can't describe anything other than great compared to what I felt like 6 weeks, 7 weeks ago. When I came in pre-op even, my quality of life was pretty much a zip. It took everything I could do just to get up and get out of the bed and get to work and get home and honestly go back to bed. I couldn't fix a meal for my family. We loved our weekends. I have adult girls and they have their families, and everybody came in on weekends and getting groceries, doing a meal. Those were very important. It was our family time. And my girls were basically having to take care of the meal. Before we ate, I was having to get up and go to bed. And I have a 4-year-old grandson, which I love. And sometimes he would just come and get in the bed with me, and it was a ridiculous way to have to spend your life. So now I very seldom am I, even at 6 weeks post-op, having to go get in the bed. About the surgery was everything that Dr. Hayes said it would be. I can't say enough about Dr. Hay. He has a professionalism that is remarkable. He's a perfectionist, which I appreciate. I feel like I'm a perfectionist when I go to work, and I see that in others when it's there, and I think his is just way above and beyond, and I appreciate that. You don't get that everywhere that you go. I imagine that when he goes into an OR, he probably doesn't work with a staff in there that is anything less. I don't remember those people because they probably knocked me out the minute I went in that door. The nursing staff, I'd like to tell you all when I came out, thank you so much. You kept my pain under control. I imagine that's difficult with us. I had a lot of work done, and we knew ahead of time to keep my pain under control would be difficult at best because I was in so much pain beforehand, but you all did a great job. The physical therapists, you all were excellent. You were so patient. You got me up. You made me feel secure. You got me to the bathroom, which I appreciated very much because those nurses were absolutely going to take that catheter out on day number 4. I remember that. You showed me how to get in and out of the car. Your patience you were just great. I appreciate all of you all so much. Thank you very much. The nurses' aides, the housekeeping when they came in, the dietary folks were really great in getting the trays right and, just making sure that everything was perfect. But today is my 6-week follow-up. Oh, I wanted to go back though. The 2 weeks at home, right after the 3 weeks, right after the surgery, Dr. Hay will tell you that the first 2-3 weeks are pure hell. They are.
He described it initially as the first 2 weeks are, and he was looking for a word, and I think he said bad, just bad, and that was a pretty fair description. They are fairly bad. She was in a lot of discomfort then, trying to search for, I guess, a comfortable position, and there's not really one to get into at 2 weeks, but the pain was different pain. She had pain initially because she needed the surgery. The pain afterwards was a post-op pain, and that's a different type of discomfort, and it's one that you have to realize, even though it is discomfort, that pain will go away. So it's almost, even though you have it, you look forward to this will go away. and you know that you can work through that. So it's something that you can look forward to.
Whoever's helping you, they'll stuff pillows here, they'll stuff pillows there. Whoever your caretaker is, whoever's helping you, be patient. You won't be able to make your patient comfortable, but you need to keep trying, but be patient. And
It is workable and well worth the effort to go through it, whatever it takes to get it done, whatever it takes.